have lots of different size syringes available to us. Now, the important thing is choosing the correct size syringe for the volume that you're going to be drawing up. So what you will do is you will choose a syringe that is just big enough to accommodate the volume that you're drawing up. So here I have a 3 cc or mil, you'll hear those units interchangeably, 3 mil syringe. If I'm going to draw up 2.5 mils of a medication, you can see here the graduations, 0.5 mil, 1, 1.5, 2. The appropriate size syringe would be a 3 mil or 3 cc syringe, because it's a syringe that is just big enough to hold that volume. I wouldn't be choosing one of these, a 6 mil syringe or a 12 mil syringe. We want to be able to have good control and not have too big of a syringe than necessary. Different options for syringes. This is a tuberculin syringe, and it actually comes with the needle attached onto it. And it's a smaller gauge needle, and you can see the graduations on the syringe. They go up to 0.5 mil. It's very important to read and double check the graduations on your syringes, because they will vary depending on the size that you're using. This one here is a 1 mil syringe, or you can see it says 1 mil or 1 cc. Another option is our 3 mil syringe. And these all have standard ends on the syringes here that will fit a needle. This is a 6 mil syringe. Now this one here is a 12 mil syringe, and the difference with this one is it has an eccentric tip. So what that means is if you compare the 12 mil to this 6 mil syringe, you can see that the hub of the syringe is actually in the center. It's in the very center of the end of the syringe, where this one is just off to the side. Now these ones are not used as commonly, and you can get other 12 mil syringes that have the normal centered one. These ones are typically used for giving medications or fluids to patients through an IV catheter port. So that way it will balance flat on the patient's limb. So if I have an IV catheter here, I have the injection port here, and the syringe will actually lay parallel and go directly into the IV catheter port. It ends up not being on an angle. So it's for easier access and use for the technician. This one here has a curved tip, and this one actually doesn't let you apply a needle to it. And what these ones are typically used for is for dental procedures. So this is a 12 mil syringe, and it has the curved tip, and you would draw up medications such as Novodent or some mouth cleaning solution that you would use for your dental procedure. And it helps you get to those hard to reach areas in your patient's mouth. Here we have a 25 mil syringe. And you can see that it's a different brand. These ones have been Monoject, and this one is a Terumo. So depending on the type of brand that you use at your clinic, it will vary depending on which clinic that you work at, but the general volumes and sizes of syringes stay the same between companies. This one here, you can see, has what's called a Luer lock. So it actually has a needle an end for a needle that you can twist on. The next ones we have here are 60 mil syringes, and you can see that there are different types for these as well. This one here is called a catheter tip syringe, and you can see how it has a much wider, and then it narrows down towards the tip of the syringe, where this one is a regular one, as the previous ones demonstrated, and it's in the center of the end of the syringe. Here we have a 3cc syringe in a sterile package. And you can see, looking at the package, it tells you exactly what size your syringe is. For my patient, I have chosen a 23 gauge times 3/4 inch needle that I'm going to use to draw up my medication. For demonstration purposes, we are using the sodium chloride. So what you're going to do is you will open up your syringe package. Note that I've kept the sterile end of the syringe still in the package until I'm ready to use it. I can touch this end of it, so the working end stays sterile. And now with my needle, what you want to do is you do not want to ever push the needle through the package, as what that will do is it cannot be sterile after breaking it through the package like that. You must open the package sterilely. So you want to take each end of the package, peel that back. I'm going to hold on to that, ensuring that I am not touching the sterile end of the needle that will go onto my syringe. I'm going to take my syringe and I'm going to place them together. And just to ensure that it does stay on, because this is not a Luer lock syringe, I give it just a gentle push together and sometimes just a slight turn, just to ensure that that needle will stay on the syringe. Now, what I'm going to do is I am going to draw up my sodium chloride. Okay, it is a new vial, so what I can do is I can pop this cap off and the rubber stopper will be sterile. If it was a medication that is a multi-dose vial, what you will do is you will take a little bit of alcohol and put it on a gauze or a cotton swab, and once the rubber stopper is there, wipe the top of it just to prevent any contamination. Now I've already checked to make sure that my medication isn't expired, so I'm ready to go. So I'm just going to take my thumb and push that off. Here you can see the rubber stopper, and you'll note that there is a circle within that rubber stopper. You're going to insert the needle within that circle when you're drawing up the medication. What I'll do is I'll take my nail and hold the base of that needle onto the syringe and just give it a little bit of a wiggle, because they can be a little bit finicky and sticky. And you can see that I've now loosened the cap off of my needle. I'm going to take that off, place that on the table because I will need to save it. And now I will draw up my medication. So what I'm going to do is, you can see how I have my fingers resting on the base of my hand that's holding the medication. That's to help give me extra control of my needle, especially when you're first learning, as students tend to be a little bit nervous and their hands can shake a little bit. So it does help to have your hands resting on the base of your other hand holding the medication to give you that extra control. I'm now going to insert my needle into the saline bottle. I'm going to draw up, I need 1.5 mils, so I'm drawing back on my plunger here with my middle finger, and it may vary. Each technician may use one finger, they may use 2 fingers to draw back on the plunger. So I'm going to draw back, and you can see that I am drawing back a little bit past the volume that I need. And then I'm going to advance the plunger to try and get rid of those air bubbles. And now I am going to remove my needle from the injection medication bottle. And now I need to recap my needle, and it's very important to do that safely. So what I'm going to do is I have the lid of the cap for my needle. I'm going to leave it on the table and hold it gently, and I'm going to now slide my needle into there. It's very important to do it this way, so that way you don't risk a needle stick injury. Now that I have that on there, I am going to reassess my syringe, and I can see that I have a couple of little bubbles, and we do not want to have air in our syringe. We do not want to cause an air embolus in our patient. So I'm going to flick the syringe and make sure that the bubbles are removed. And I don't know if you noticed when I did that, the needle became a little bit loose. It started to wiggle, so I just made sure that I attached that and that it's secure. And now I can see that I have 1.5 mils. So when you are looking at the volume that you're drawing up, you're always looking at the top part of the plunger, not at this bottom part and not at the top of that little meniscus. You're going to look at this top part of the plunger right here. On my medication, it should always be labeled so no mix-ups happen, and so that way we know exactly what we're giving to our patient. And you want to make sure that when you place the label that it is not in any way blocking the graduations or the area where you're going to see it go into your patient. So you'll see that I have it on the back of the syringe.